Hi, good evening, and welcome back to this series on professional exams made easy, where we are discussing most important topics for your university exam. And since Monday, we had started discussing the topics with using few incomplete handouts of workbooks. We will do the same today. Last class, we had discussed about one of the most important long essay that is asked from the topic of abdomen and pelvis, that is the uterus and its supports. In this session, we will focus on the anatomy of interior of few GI organs as well as the urinary organs, right? So in the GIT and in the urinary tract, we get about like 4 to 6 questions where the question will be based entirely on the features of the interior of these organs. So let's try and discuss about the anatomy of these organs. First, let's start with the interior of second part of the duodenum. Now, usually this is a standalone 5-marker question or could be a part of 10-marker question where they will ask about parts of the duodenum, relations of the duodenum, and specifically focus on the features of the interior. So this is a very important short essay or 5-marker question for your exam. If this is asked, how we should present the answer? You should write the features of interior of the duodenum under these 5 headings, right? If the question is describe the interior of the duodenum, then we can begin with the interior of the duodenum shows transverse mucous folds, which are very prominent beyond the second part, right? And then we can focus on the interior of the second part in detail. So interior of the second part has circular folds, which are called as valves of Kirkring. These are permanent mucosal folds, right? So these are permanent mucosal folds, right? Now, these folds become well-defined, right? Well-defined after major duodenal papilla, right? This is what we need to write for valves of Kirkring. So circular mucosal folds are called as valves of Kirkring. They become well defined beyond the major duodenal papilla, right? Now, what diagram should we draw for this question? Remember, we need to show the features of the interior of the second part, right? So let's imagine this is the first part, this is the second part, and this is the third part, right? As we said, the second part has transverse mucosal folds, right? So first, show the transverse mucosal folds. Then, the most important feature here is the major duodenal papilla, right? Now, major duodenal papilla, remember, is present in the posteromedial wall of the duodenum. Posteromedial wall of second part of duodenum at a distance of about 8 to 10 centimeters from the pylorus. This is very important. Most of the time we end up writing major duodenal papilla. We do not know what to write. Okay. So this is what we should write. So it is present in the posteromedial wall. It is at a distance of 8 to 10 centimeters from the pylorus. Okay. Then it represents the opening, right? It represents the opening of the common bile duct, right? So this is where the common bile duct opens. One other point which I want you to highlight is this represents the junction of the foregut and midgut, right? Or otherwise, what we call this as, this is the location of anterior intestinal portal, which actually represents the junction between the foregut and the midgut, right? So let's try and show the major duodenal papilla here. Okay. So let's imagine this is the major duodenal papilla present at about 8 to 10 centimeters from the pylorus. And this is where the common bile duct opens, right? Then what do we write for minor duodenal papilla? Remember, minor duodenal papilla is an opening, right? It's an opening present about 2 centimeters above the major duodenal papilla, right? So let's say this is where we will have the minor duodenal papilla. What minor duodenal papilla represents? Remember, this represents the opening of the accessory pancreatic duct. Major duodenal papilla, common bile duct, and it represents anterior intestinal portal, whereas minor duodenal papilla represents opening of accessory pancreatic duct, right? Then the fourth feature. So the fourth feature is the arch of plicae semicircularis, right? So this is a semicircular fold, right? It's a semicircular mucosal fold arching over major duodenal papilla. So this is how it looks. So this is the plicae semicircularis. Coming from the major duodenal papilla but running downwards is plicae longitudinalis, which is a longitudinal fold, right? Coming from the major duodenal papilla extending towards the third part of the duodenum. This is how we should describe the interior of second part of duodenum. So this is one diagram we need to do, right? Label it major duodenal papilla, minor duodenal papilla, plicae semicircularis, plicae longitudinalis. These are valves of Kerckering. Done. Of all the questions that we will discuss today, possibly this is very important, right? Interior of the second part of duodenum, right? Are we clear? Yeah. Hi, Amulya. So this is regarding interior of the second part of duodenum. First, interior of the organ that we need to know. Then, once we have learned this, let's focus on the interior of the cecum, right? Now, we can directly start with the answer. Again, this is a very important 5-marker question or a 3-marker question for your university exam. Interior of the cecum. Also a very important discussion topic. Now, how do we begin? And the presentation of the answer, right? So what exactly is cecum? Remember, this is the beginning of the large intestine, right? So this is the first part of large intestine. Large intestine is divided into cecum and appendix, colon, then we have rectum and anal canal, right? So this is the beginning of the large intestine. It is a blind pouch, right? Now, why it is called as cecum? The literal meaning of cecum is blind. It is closed at one end and open at the other. That is why we call it as cecum. Just one line of definition. But the interior of the cecum presents 2 important orifices. What are these? The first orifice is called as the ileocecal orifice. The second orifice is called as the appendicular orifice, right? Now, what is ileocecal orifice and where is it present? Okay, remember, ileocecal orifice represents the opening of ileum, right? So ileum opens into interior of the cecum, and where is this opening present? This is also present in the posteromedial wall, right? It is present in the posteromedial wall. Now, what is the structure of this ileocecal valve or ileocecal orifice, right? So this ileocecal orifice is guarded by a valve. Now let's try to draw the outline, okay? So imagine this is the outline of the cecum, right? So this is the outline of the cecum. And let's imagine we have the vermiform appendix arising from this, right? So the ileum will open into the cecum. So we have the ileocecal orifice here, okay? This ileocecal orifice is guarded by a valve. Now this valve is produced by reduplication of mucous membrane, right? So this is the ileocecal orifice. So this is the first thing that we need to show. Then guarded by a valve which has an upper lip and lower lip. The upper lip is usually horizontal, lower lip is concave above. Right? Where both the lips join, this is called as the frenula. These are the things we need to write. But the most important thing we need to write here is now how to locate this ileocecal orifice. Ileocecal orifice is usually present at the junction of the right lateral plane and the transtubercular plane. That is where we will have the ileocecal orifice in the posteromedial wall of the cecum. This is what we need to mention. Are we clear? Right. So this is regarding the ileocecal orifice. Then what about appendicular orifice? About 2 to 2.5 centimeters below, we have one more small orifice. Okay. Now this orifice is what we call as the appendicular orifice. So what is appendicular orifice? Remember, this is the opening of the lumen of vermiform appendix. Where is it located? It is located at about 2.5 centimeters below the ileocecal orifice. Right? The orifice is much smaller. Remember, the diameter of the appendix is very small, right? So this is a smaller opening compared to the ileocecal orifice, right? Now this is also guarded by a valve. Now this is important again, guarded by a valve. Now what is the name of the valve? Remember, the name of the valve is the Gerlach's valve. Fine. So this is how we should describe it. Interior of the cecum, very often 3 marker, but could come as 5 marker, and this is how we should describe it. Okay. Now, what is the clinical anatomy if you want to add? Remember, the cecum actually acts as a guide in telling us which part of the intestine is getting obstructed. Okay. Remember, if the cecum is empty, there is no content in the cecum, the intestinal obstruction is usually in the small intestine. Right? If the cecum is full, the intestinal obstruction is beyond the cecum. So cecum actually acts as a guide to tell us what is the site of intestinal obstruction. Are we clear? So if interior of the cecum is asked, this is how we need to write, and this is the diagram that we need to draw. Right? If you are attempting a 5 marker, what is the time limit that we discussed? Probably around 8 to 10 minutes if it's a 5 marker question, nothing beyond this. This is the second important organ from which questions on interior of the organ are asked. Right? Done. Then the next important question we have is the interior of the rectum. Again, a very important 5 marker question. Okay? The interior of the rectum and anal canal are very frequently asked. Right? So first, let's talk about interior of the rectum. Now, rectum, as we know, what is it? It's a part of the large intestine, which is straight. That is why we also refer it to as rectum. Remember, the course of the rectum is not straight. It has curvature, right? So it's a misnomer. So interior of the rectum, which is straight, and it is devoid of. What are the features that we identify in large intestine? The tinea coli, right? Then ostrations and saculations. So these saculations and ostrations, and also appendices epiploicae. These structures are not seen. These cardinal features are not seen, right? Are we clear? Yeah, I am here. Now, how do we describe the interior of the rectum? So start with one line of introduction. That's the first thing we need to do. Then the interior of the rectum shows temporary folds, which are longitudinal folds, right? And they disappear with distension of the rectum. That is why we call it as temporary folds. Whereas the permanent mucosal folds, remember, these are transverse folds. Right? These are transverse. And as the name suggests, these are permanent folds, also referred to as what? Houston's valves. Now, this could be again an important 3-marker question. Houston's valve, rectal valves. Okay, permanent, and their peculiarity is they become prominent with distension. So these folds are exactly opposite to longitudinal folds. They actually become prominent with the distension of the rectum. Right? These rectal folds or Houston's valve, these are of 4 in number. Right? Now we can simply remember it in which direction or which side it is present. Okay? Please remember like this. The first valve is present in the right wall of the rectum, then left wall, then right wall, and left wall. If you have difficulty in remembering this, it's easy to remember, right? So right, left, right, left. This is how we remember the position of the valves. So they attach to the respective side of the rectal valve, right? Of which the third one is the most constant, right? So this is the most constant, and this is also the largest, right? This is also the largest valve. Whereas the first one arises from the right wall, and this is present at the rectosigmoid junction. So this is found exactly where the sigmoid colon continues as the rectum. This is the location of, yeah, hi Anita. So this is the location of the first valve, right? Rectosigmoid junction. Now, where is the third valve present? Remember, the third valve is present at the level of the rectal ampulla. Right? This is very important. We need to remember. Then, what about left or the second valve? The second valve is present 2.5 centimeters above the third valve. The fourth valve, which arises from the left wall, this is present 2.5 centimeters below the third valve. So this is why we need to remember clearly about the third valve. So once we remember this, we can write the rest. From which wall it comes, where is it located, and how the position of the second and the fourth valve gets defined by this. Are we clear? So this is how we describe the interior of the rectum. Now, what is the diagram that we need to draw? Okay. Now, we can show a simple diagram here. So let's imagine this is the outline of the rectum that we are drawing. So first show the first valve arising from the right side. So remember, this is right, this is left, this is above, this is below. Right? Now, so draw the outline of the rectum. How about the second valve? The second valve comes from the left side, right? So draw it. And then comes the enlarged rectal ampulla, which has the most prominent wall. So show it in a different color, right? Then continue and show the fourth valve. So this is how we can show the interior of the rectum. Label it as first Houston valve, this is second, and the most important, this is the third, and this is the fourth valve. This is how we should describe the interior of the rectum. So start with temporary folds and then go for the permanent folds. Are we clear? Right? So this is how we should describe the features of interior of the rectum. Done? Are we clear? Now, if you write it in this structured way, there is very little chance that you will lose marks. So simple description as bullet points, a diagram to go with it. Right. Then the next important question is the interior of the anal canal. Now, this is a potential main question or short essay. So this could be your 10 marker or this could be a routine 5 marker question. But This is very important. Similar to the second part of the duodenum, we have seen questions on interior of the anal canal plenty of times, right? So this is one question you need to be prepared with. Now remember, the anal canal is, what is anal canal? A simple one-liner, okay? Now what is anal canal? This is the terminal portion of, this is the terminal part of large intestine. So it's always better to start your answer with a line of introduction, right? So anal canal is the terminal part of large intestine. It is divided into an upper part, right? And a lower part, right? Some of the textbook describe it as upper third, middle third, and lower third, but we will stick on to this classification. Upper part, lower part. By what? By pectinate line. Now, this is the word that you need to highlight. Okay? Underline or highlight or write it in capital letters. Okay? So, divide it into an upper part and a lower part by pectinate line. Then, what are the features present in the upper part and lower part? Go on describing. For this, we need to draw the diagram, right? So draw the outline of the interior of the anal canal. As we said, this is divided by a line called as pectinate line into upper part and lower part. The lower part continues further, right, as the anal opening, right? Now, this line that we have here, this is called as the pectinate line. So this upper part measures about 15 millimeters. What is the total length of the anal canal? 3.8 centimeters, right? Or 38 millimeters. So the upper part measures about 15 millimeters. The interior of the upper part shows longitudinal folds. Okay. So longitudinal folds, mucosal folds, which are called as the anal columns. So these are the anal columns. These anal columns show a mucosal folding in the lower part. So this is what we refer to as the anal valve. When all the valves are put together, the line that we get, this is what we refer to as pectinate line, right? Then the space above the anal valve, this is called as the anal sinus. So what we need to do is we need to describe all the three features. What is anal column? It is the longitudinal mucosal fold. What is anal valve? It is how the anal columns are joined with each other by their lower ends. What is anal sinus? Anal sinus is the space above the anal valve. Then two more features are often described in other textbooks. One is called as the anal papilla, which is a small mucosal tag which comes from the anal valve, right? So this is regarding the upper part, right? Then what are the features that we see in the lower part? The lower part is further divided into two regions, right? The upper zone, right? And the lower zone, right? Now this roughly measures about 15 millimeters and the lower part measures about 8 millimeters. Now what separates the lower part into these two subdivisions? This line is called as Hilton's line, right? So this is the bluish pecten zone, right? Now this is the part which is lined by skin, right? The lower 8 millimeters is lined by the skin. Are we clear? So this is how we should draw. Now the upper part, mention it as, this is measuring about 15 millimeters. This is bluish in color. Now the question is, why is this bluish in color? Remember, this is lined by stratified squamous, non-keratinized epithelium. Deep to this lies the deep venous plexus. Okay. So because of the presence of deep venous plexus, this looks bluish. The white line of Hilton, okay? So white line of filter divides it or separates it from the cutaneous part of the anal canal. Right? So this is regarding the lower part, its upper subdivision, the zone of pecten. Then below this, we have the lower part, which is lined by the skin. Right? Are we clear? This is what, and this is how we should describe the interior to begin with a diagram. But this answer is incomplete, right? What else we need to draw? Remember, we need to draw the table for the interior of the anal canal. Why? Remember, mention this line that the pectinate line is called as the watershed line. The watershed line of anal canal. Right? Pectinate line is called as watershed line of the anal canal. Right? The reason is you need to show it in the form of the table. Are we clear? So above the pectinate line and below the pectinate line, everything differs in anal canal. For example, when we talk about development, above pectinate line, the development is from the endodermal cloaca. Now, hope we still remember what do we mean by cloaca. Cloaca refers to the post-allantoic part of the hindgut. Right? So this is the endoderm. Then below pectinate line, remember, below pectinate line, it develops from the ectoderm. And because of this, there are a lot of changes that will happen. The lining epithelium above the pectinate line. So let's imagine it is simple columnar, which is the lining epithelium of majority of the large intestine. But below the pectinate line, it is stratified, squamous, non-keratinized, and below the white line of filter, it is actually lined by skin. Isn't it? Yes. Then what about arterial supply? Above the pectinate line, it is supplied by the superior rectal artery. Right? Below the pectinate line, it is inferior rectal artery. So the rest of the differences are pretty simple. What about venous drainage? Simply write superior rectal vein, here inferior rectal vein. Isn't it? What about nerve supply? Above the pectinate line, it is innervated by the autonomic nerves. And because of this, it is pain insensitive. Right? Whereas the lower part is by the somatic nerves. In fact, the inferior rectal nerve and also perineal branch of fourth sacral nerve. Then, what about lymphatic drainage? Lymphatic drainage, above the pectinate line, it is into internal iliac nodes. Below, it is into superficial inguinal nodes. Right? This is one feature we need to remember. Right? Above, it is into internal iliac, and below, it actually drains into the superficial inguinal nodes. Then, what about hemorrhoids? Hemorrhoids that occur above the pectinate line are called as internal hemorrhoids. Outside or below the pectinate line, we call it as external hemorrhoids. Right? So this is how you start describing it. Draw a diagram, and then this is how, right? So this is how we put the table and we explain the differences, comparing and contrast the features of the upper part and the lower part, right? So this table is again very important for you. Are we clear? Remember, of the questions that we discussed till now, the interior of the anal canal is one question which could come directly as a 10 marker. Interior of the duodenum could be a part of the long essay, but this is a definitive long essay for you. Are we clear? Right. So this is regarding the interior of the anal canal. Right. Once we have learned this, let's focus on the interior of other organs that could be asked. So in GIT, duodenum, cecum, then the rectum and anal canal, right? Occasionally, they may ask about interior of the stomach, but in the interior of the stomach, all we need to describe is presence of longitudinal mucosal folds, which are temporary, the presence of Meganes or the gastric canal, right? Done. That's it. Now, the next important short essay we need to know regarding interior of an organ is the interior of the urinary bladder. Again, remember, this is a very important 5-marker question, right? How do we describe it? Again, what exactly is urinary bladder? This is a muscular bag that stores the urine. Urinary bladder is the muscular bag that stores the urine, should be the first line. Then, interior of the urinary bladder shows following features. Then we can start describing temporary folds. These temporary folds are very prominent in empty bladder, right? Again, they tend to disappear in a distended bladder, right? Apart from these temporary mucosal folds, the most peculiar feature of the urinary bladder is the trigone of the urinary bladder, which itself could be an important 3-marker question, right? Now, what exactly is trigone? Let's try to understand. If we draw the outline of the urinary bladder, so let's imagine this is the outline of the urinary bladder, continuing as the urethra. The posterior wall or the posterior surface of the urinary bladder shows a triangular area, right? It shows a triangular area where we have the opening of the ureters and the urethra, right? So this triangular area, right? Triangular area present in the posterior wall of urinary bladder where the mucosa is smooth, right? Rest of the area of the urinary bladder, we will identify the mucosal folds. But in the posterior wall of urinary bladder, we will identify these triangular area, right? This triangular area is what we refer to as the trigone of the urinary bladder, right? Now, what is the extent? Remember, above it extends from the ureteric orifice below to the urethral orifice. Okay, so it extends from ureteric to urethral orifice. This is the extent, right? Then what are the features we need to draw? Remember, here we need to talk about how these boundaries are formed, right? Now, first, let's talk about the superolateral boundaries, right? So what is present superolaterally? Superolaterally, we have the ureteric opening, right? Then inferiorly, what do we have? Inferiorly, we have the urethral opening. And this urethral opening is guarded by the uvula vesicae, right? Uvula vesicae, right? Which is an elevation produced by the median lobe of the prostate. Done. So this is the inferior boundary. Then what about the superior boundary, right? The superior boundary is formed by the interureteric ridge, right? Then what about this? These are called as laterally we have urethral ridge, right? So the interureteric ridge that we have, this is called as the Mercius bar, and then the ureterourethral ridge is also called as the Bell's bar. These are the mucosal elevations which form the superior and the lateral boundaries of the trigone of the urinary bladder. Are we clear? So this is how we should go on describing the feature of the interior. Once we describe this, we need to end the answer with the developmental importance of the trigone of the urinary bladder. What is it? Remember, the entire urinary bladder is derived from endoderm. Okay? The urinary bladder is a derivative of the endoderm. In fact, the cloaca, whereas the trigone is developed from mesoderm. Now this we need to highlight, right? The trigone of the urinary bladder develops from the mesoderm, from the absorbed parts of the mesonephric ducts. This is the answer the examiner will look for, right? Now, if you have written this, your marks are guaranteed, right? So this is how we should describe the interior of urinary bladder. Done? Are we clear? Right. So this is regarding the important interior of one of the pelvic organ which can be asked. Now, one more important urinary organ on which we can have the question on interior of its feature is the prostatic urethra, right? So, of course, this is present only in males, right? Prostatic urethra measures about 20 centimeters, and the beginning part is what we refer to as the prostatic urethra, right? Now, prostatic urethra at least mention one line saying that this is the widest and the most dilatable part of urethra. This could fetch you some marks. So this also is an important MCQ question for you. Which is the most dilatable and widest part of the male urethra? Remember it as the prostatic urethra, right? Then in the internal features, what we need to write? First, let's try to draw the diagram. So in the diagram, all we need to do is first draw the outline of the prostate gland. Okay, so let's imagine this is the prostate gland. And in the center of the prostate, right, we have the outline of the male urethra, the prostatic urethra, right? So the median part of prostatic urethra presents a mucosal, a longitudinal mucosal elevation, right? This is present in the midline and we call it as the urethral crest, right? Then the middle of the urethral crest presents a circular swelling, right? This is called as colliculus seminalis, right? Now, opening into the colliculus seminalis, we have an opening called as prostatic utricle, right? Prostatic utricle. Prostatic utricle is a blind diverticulum, right? It is a blind diverticulum extending from this opening of colliculus seminalis. This represents the vagina in case of males. A very important Viva question. And once you have written this you need to highlight. This is the male counterpart of vagina because this is formed by fusion of the caudal part of paramesonephric ducts. Are we clear? Paramesonephric duct, as we know, mainly give rise to the female genital tract, the caudal portion of which gives rise to development of vagina, right? In case of males, right, it forms prostatic utricle and hence it is referred to as the male counterpart of vagina. Are we clear? On either side of this, we have the opening of the ejaculatory ducts, right? We have the opening of ejaculatory ducts, and by the side of the prostatic urethra, we have the longitudinal spaces. These are called as prostatic sinuses, where the prostatic glands open. Done. So other openings, what we need to discuss, one is ejaculatory duct and the other one is the prostatic glands. Again, this could be a very important 3-marker, or the diagram of this is very often asked, right? Diagram of the prostatic urethra or the interior of prostatic urethra. Are we clear? So this is how you need to describe it. Done. In the topic of, in the region of abdomen and pelvis, these are the 6 most commonly asked interior of the organs. 5-marker, 10-marker, as well as 3-marker question. Fine. So these are the questions for which you need to be prepared. These are the topics that you should never skip. Are you clear? No matter which university you belong to, these are like the favorite topics of your question paper setters. Fine. So these are the topics that you must be thorough with. Right? Hope the topics that we discussed are clear and will help you in scoring better in your upcoming internals or university exams. Right? If you have any doubt regarding whatever we have discussed till now, please do ask before we close. If you want me to discuss any specific questions, like how to present the answers in the exams, if you have difficulty with respect to a few questions, please do share. We will discuss, we will take up these topics for further discussion, right? Regarding how to present the answers for these questions, how to draw diagrams, how to present answers for these questions, we'll take up in next session. If you have any such topic, please do let me know, right? Since I don't see any questions, I thank each one of you for joining the session. Hope this session will be useful in presenting answers in your exams. Next Monday, we will come up with few more important topics, which will often be asked as long essays, short essays, or short answers in your exams. Thank you for joining.